procedure takes about 30 minutes. The nurse or doctor will prepare a trolley with the equipment needed to insert your PICC. They will wear a mask, gown, hat and gloves to make sure that everything is kept as clean as possible.
PICC line, it is received like this, sterile. Then keep it on the table and open it like this. Make sure that none of the items jump out. This has got a needle which is sharp needle, Seldinger needle, and this is the needle with which we puncture, and it has got a safety device. If you pull it off like this, it will get locked. So ensure that you don't pull it, keep it here. You puncture the vein with this needle, and there is a guide wire. This guide wire, we have to remove this straightener and pull the guide wire and keep it like this. I hope you can see the guide wire.
Yes, sir.
This is a soft tip wire. We keep it like this. So we puncture the vein, and then through this you pass the guide wire. Once the guide wire is in, we remove the needle, and then we take this knife, the 11 blade knife. This knife has to be operated like this. Press here and pull back. Knife gets opened. Then you make a stab, and then again push it. It will get locked. It will not cause sharp injury. Once this is made, this is the dilator with the peel-off sheath. This is the dilator. This is the peel-off sheath. So we pass this over the guide wire and put it into the vein. Once it is in the vein, you can remove the dilator and notice blood coming from the dilator. And then you can put the dilator back. From the sheath it will be bleeding. You can put the dilator back and wait. And this is the catheter which is used for insertion. This is a PICC line which is 50 centimeters in length, and usually we insert about 35 centimeters, and it has got 2 lumens. So what we have to do is, if we are not requiring, sometimes you require to maneuver using C-arm, this guide wire is required. Otherwise, you can remove this guide wire. Don't throw any of the items which you have removed. It may be required at some point again. So carefully loop this and make sure that it is safely kept here. And this guide wire, this is the catheter. We measure it from the point of insertion up to the suprasternal notch.
Okay.
If this is the point, you cut the catheter here and insert it. Once the catheter is inserted, the nurses will give us clave connectors which we connect here and flush the line. And another important thing about flushing is that when we are assume there is saline in this, you will flush. As you are flushing, you will apply the lock so that there is no blood returning into the catheter.
Okay.
So make sure that there is no blood inside the tip of the catheter that can cause blocking. And once this is done, this catheter is fixed by this. Ensure that there is this sticker doesn't come in contact with the alcohol. It is written here. You can see here, remove with alcohol. This sticking property will be lost if you apply alcohol. So ensure that there is no alcohol when you apply this, and this is put, we fix the catheter like this and close these two, and then peel this off. The catheter will be stuck to the skin. No suture is to be put, only by sticking. So that is how PICC line is inserted. Guide wire is in. Now we will remove the needle. All the time taking care of it. This one, don't pull it and lock it now. Keep it like just like that. And this is a knife. Press it here, pull it back. There is no need to remove the tourniquet when you pass the guide wire. Make a nick here. Small nick is enough. Then lock. And make sure that the nick is just by the side of the guide wire, not a separate point. And then this is the dilator, and this dilator is flushed, and then you pass the dilator, and it has to be passed easily into that. And then when it enters the vein, move the guide wire and make sure there is no kink. Push the dilator fully in, move the guide wire so there is no kink. And also at this point with the guide wire in situ, remove the dilator and see if there is bleeding. There is blood here, so I am quite convinced I am inside the vein. Now from this point you lay it across the arm, axilla, this suprasternal notch. Usually it will be about 35. In this man it is 36. So this is cut square with the knife. It is cut now. So make a note of what distance it is. This is 35, 36, 37. And then this catheter is flushed. The other lumen is also flushed. And now we remove the guide wire. It might bleed, so keep a gauze piece close to it and remove the guide wire. This guide wire and dilator should be kept carefully if necessary for another use. It may be just by the side of a valve, so it is not bleeding. It should go easily into this, and when you reach this point it will not go any further because this part of the catheter is thicker than the peel off sheath. So now you take saline from the lumen, you check there is a free flow of blood, flush it. As you are flushing, stop it. The red lumen now, aspirate and free flow of blood, stop it. And once you have passed, you break this peel off like this. 1, 2, 3. I have broken this. Once you have broken and peeled off, it cannot be reused. So you have to be perfectly sure that the catheter is in the vein before you peel it off. And till you peel off the catheter completely, the PICC line will not go inside. So as you are peeling, ensure that the PICC line doesn't come out fully. Now the catheter has completely gone inside. Clean it off. Don't use alcohol. Just saline cleaning is enough. And then the catheter is in. Kept on this so that these ears of the fixator gets the two knobs of the PICC line. Then it is firmly shut, closed like this. Then this is kept close to the patient and this is pulled off, so it is fixed. And we can place another additional dressing like this over this and put a plaster. Thank you.